So there's a lot of very interesting research being done in CTCL, particularly in mycosis fungoides and Sézary syndrome. I think that you can break it down according to type of research and target focus. One is genomics, molecular targeting, pathways, and so on. There have been a number of studies looking at single cell, for example. That is very particularly interesting right now. Single cell analysis in CTCL. There are very nice studies. We just recently published one from Yale, the group in Yale, another one from the group of Moffitt looking at single cell. So those are now starting to give a little better idea of what the heterogeneity within the clonal population of T cells is, both in the blood as well as in the skin. So I think that those will be extremely productive in the short run. Another very big area of research is immuno-oncology, so tumor microenvironment, response or biomarkers of resistance to immunotherapy. And that there are a lot of different groups working on it. One of very active is the group at Stanford. Dr. Michael Cotadust is really kind of leading the field there with a lot of very nice work looking at biomarkers of response to checkpoint inhibitors, for example. Dr. Nekba, who's a dermatologist, physician scientist at Thomas Jefferson University, is also doing some very good work looking at the tumor microenvironment, particularly stromal cells, fibroblasts, and the cytokine that are regulating the trafficking of cells. Another one is Dr. Mishra, Angela Mishra, also Thomas Jefferson, who's looking at interleukin-15 and how that regulates the trafficking of T cells. And finally, another sort of area of work is currently looking at minimal residual disease, detection of clonal cells in the blood, which is important to redefine stage, because early stage is defined as disease just limited to the skin. But the more we look into that and the more sophisticated assays are being used, the more clear it becomes that often you can actually detect some cells, in the circulation that either are precursor cells for the tumor or they are circulating tumor cells. So it's a very dynamic area right now. I think there's a lot of conflicting data on it, probably mostly related to the different assays that are being used. But I think that that's going to be an important area for clarification over the next few years.